James Thomas Morning Blend. COVID-19 patients are at risk for surprise billing that may cause severe financial burdens. That is crazy. To help fight against surprise billing, Clare Krusing of the Coalition Against Surprise Medical Billing is here to talk with me today on Morning Blend. Good morning, Claire.
Good morning. How are you?
Doing great. And again, we got to let people know that you are from St. Louis. Proud of that.
Yeah. Yes, very proud of it. Proud Kirkwood High School graduate.
So, what is surprise billing and how does it happen?
So, surprise bills, unfortunately, are not a new thing with our health system. These have been going on for quite some time now, and it's one of the reasons why we feel really strongly that it's time that they're addressed. So, for millions of Americans who are unknowingly treated by a provider that doesn't participate in their insurance network, or in cases where a patient may not have any choice in the provider that treats them, such as when they go to the emergency room or if they have to make a trip in an ambulance. Those are oftentimes the most common places where a surprise bill can happen. And these charges are extreme. We're talking hundreds of thousands of dollars beyond what a patient would typically pay for the same service that's provided in network. So as the COVID pandemic continues and patients are still struggling with either the financial ramifications of COVID or even their own personal health, the fact that we don't have these protections yet is a real issue. And so we're working as hard as possible to make sure that Congress is passing legislation that would protect patients from these bills forever.
You know, how can people protect themselves against surprise billing?
So, in certain states, there are protections in place to stop a surprise bill from happening. Um, but it really does come down to the consumer before they schedule a procedure or a treatment at their hospital or with their doctor to make sure that that provider or hospital is in their network. But it's also incumbent on the hospital and the provider to be transparent about their network status too. So anytime before seeking medical care, it's always good to check who's in your network. And that's probably the best and most important way to avoid a surprise bill. The challenge, though, is again in those situations where a patient may not even have a choice in the matter and it's urgent or an emergency. I think we can all probably relate to the fact that when our health is on the line, you don't have time to make a phone call. You don't have time, to look up whether the ambulance is in your network or not. That's why it's so critically important that we have federal protections in place that avoid these charges in the first place.
You're saying a mouthful there because I was thinking, what happens if I'm here at my apartment, I collapse, I make a phone call, the ambulance shows up and takes me straight to a hospital, and I'm not able to really respond to anything because I'm in a really interesting situation physically and health-wise. Again, how do we protect ourselves from that? I mean, I'm sitting there, I can't say much, and they're admitting me, and they know, wow, let's give him a test. Oh, he tests positive for COVID. Let's get him on a respirator. I mean, how can anybody protect themselves when they're physically unable to?
Right. Well, and that's why we're fighting as hard as we can for this federal legislation, because in many cases, there's often nothing that a consumer can do. And that's why it is so unfair that this practice even exists from the starting point. What we've noticed over the last several years is that there has been a growing number of private equity firms that have found out this is a highly profitable business model for them. And so they often intentionally staff their physicians and specialists outside of insurance networks for the sole purpose of being able to charge whatever they want for their care. And that's when a surprise bill happens. And again, the only way to protect patients from these charges is through federal legislation. Even though, and I mentioned, some states do have protections against the practice, those protections often don't extend to individuals who purchase coverage on their own. So if you are getting coverage from your employer or from your job, you often don't see those protections uh, at all. And so you and your family are probably at the greatest risk of a surprise medical bill.
Now, where can we find more information? Where can our viewers go?
So if folks visit stopsurprisebillingnow.com, we didn't want to make any any qualms about where to find the information. Stopsurprisebillingnow.com will give you a tremendous amount of resources about where surprise bills likely happen so that you can avoid those scenarios if so, but also steps that you can take to contact your member of Congress and make sure that they're taking action to prevent surprise medical bills as well.
Clare Krusing with the Coalition Against Surprise Medical Billing. We really appreciate you being on Morning Blend. And if you want to give a shout out to anybody in St. Louis, now the time is to do it.
Oh, I would just like to say hi to everybody in St. Louis, and hopefully, fingers crossed for a better baseball season next year.
I'm with you on that one. Claire, thank you so much for joining us on Morning Blend.
Thank you. I appreciate it. Talk to you later.